Hi there, and welcome to A Basic Introduction to Mechanical Ventilation. This is Chapter 8.1, Ventilating ARDS, Properties of the Injured Lung. In this section, we're going to use the phrase ARDS to refer to a group of lung injuries where the lung is not compliant. Now, you can recall from Chapter 1 on compliance and understand that low compliant lungs require a high pressure in order to inflate them, and because of the low compliance, will also collapse very easily. ARDS is actually a syndrome that includes a variety of diseases and includes diseases that directly or indirectly injure the lungs. It is important to always look for a cause to ARDS. It is a syndrome, not a diagnosis. ARDS is a heterogeneous condition that varies both over time and between lung regions. Over the course of an illness, the lungs can go through stages of inflammation, edema, and scarring that will affect different lung regions at different times. Originally, this was thought to be a diffuse disease, but CT scans have shown that the pattern of disease varies across lung segments. Despite this variation, there's a general pattern that occurs. Early on, there's a high permeability edema, where the airspace is flooded by a protein-rich fluid and cellular debris. The majority of the airspace is occluded and airless at the end of expiration. Surfactant is lost, which causes the alveoli to collapse and flood the lungs with fluid, leading to a fall in the lung compliance. As the lungs start to repair, scar tissue can form that causes the reduced compliance to become permanent. This loss of compliance is due to two different reasons. First, and obviously, the airspace is lost due to flooding inside the alveoli. Second, as a consequence, open alveoli are stretched to beyond their limit as they're forced to accept the full tidal volume that would otherwise be shared with other lung segments. To compound this, the loss of surfactant makes it hard to open collapsed alveoli, so more pressure is needed to deliver the actual tidal volume intended. Even in normal lungs, at any given pressure, there are open and closed alveoli. This is one of the reasons why we see a VQ mismatch. For those lung segments that are open in ARDS, they can be exposed to higher distending pressures from the inappropriately high tidal volume. Overdistension leads to inflammation and microtears in the architecture of the alveoli. For those segments that are collapsed, there are two types of atelectasis that occur. There are compressive forces from heavy lung segments that are filled with fluid and press on the open airways. Atelectasis from gas absorption and adhesive forces is the other type and differs from the first, as it usually requires very high airway pressures to force the alveoli open. Fun fact, if you listen to the lungs in the dependent regions in a patient with ARDS, you can often hear crackles during inspiration. This is the noise from the alveoli with atelectasis that are being forced or snapped open.